So my name is Emmett Patterson. I'm a queer trans man. I'm based in Washington, D.C., and I'm a PrEP user. For me, PrEP is really important because I'm a trans man and we are often excluded from research for, when people say men who have sex with men, they often aren't including trans men. There isn't, unique research really being done on a large scale about our HIV risk, about anything related to our sexual health, and certainly not PrEP research. So for me, being on PrEP is really important because I know it's a tool that is effective for, other people. So I'm gonna use what I have, right? If I don't have solid research, I'm still gonna work with my providers. So in Washington, D.C., we have, one of the highest, new infection rates in the United States. And so for people who fit kind of, quote unquote, like a high risk profile, that includes trans folks, that includes sex workers, that includes, men who have sex with men, gay, bi, and queer men. My provider kind of had been pushing PrEP for me back in, 2013, 2014, and I was like, I feel like I don't know about that. I feel like I don't need it when I, really kind of started dating, particularly cisgender men. I said, this actually might feel really good just to kind of have, an added layer of protection for myself. There's not just one type of trans person, but, we all experience, different levels of access. So, I'm a white trans person living in a major city in the United States. Like, it's actually pretty easy for me to get access to PrEP. But for folks who are living in the South, trans people of color, trans people who kind of have those competing priorities as it relates to their health, things like getting access to hormones, to just getting a doctor's appointment with someone who will actually see you and not deny you care because you're transgender. I think that that's the big issue that I see. What I would look for from community organizations and people who have, control over PrEP is making sure that you're making it financially accessible and that you are also addressing all of those competing priorities that come up for trans people.